Vardhaman Kankaria with us, chairman of Asian Eye Hospital, Pune. The patient is 26 years old, male, high myope with astigmatism, around 11 diopter of sphere with -4 diopter of cylinder at giving 6 by 9 parts vision. And the angles are open, fundus is normal, and the ACD is adequate. And we are planning to implant ICRIL by Biotech, Phakic IOL, Toric in this patient. Over to Dr. Vardhaman Kankriya, sir.
Yeah. So first of all, thank you to Dr. Namrata ma'am, Dr. Gaurav and the entire team of AIOCMT3 and also the Drishti Eye for the kind opportunity. Friends, this is a patient who has a very high myopic astigmatism. We are going to showcase the Biotech Acryl Phakic lens. We all know that currently in refractive surgery, it is important that you master all the armamentarium of refractive surgery, right from corneal and lenticular procedures. And in the lens bends procedures, whenever the myopia is beyond -8 spherical equivalent, the go-to procedure has become the phakic lenses. Acryl phakic lenses is one of the preferred choice when you're looking at a reasonable but good quality phakic lens implant. I've already made the side ports and the main port, the visco is already in the entry chamber. So I'm going to showcase how this lens is loaded. This lens comes like this. There are 5 holes that you can see of 360 microns. But in terms of orientation, you have to look at this hole, which is on the left haptic here at the foot plate. So that has to be there on the leading haptic. And it is important that you load the lens quite well. Now, this is easy to load compared to the other loading phakic lenses, which require bimanual approach and front loading forceps. But apart from that, in this case, the loading is almost like loading a plate haptic IOL. So now this lens is in its place. I'm going to just make sure that it is absolutely nicely loaded. 1 second. Yeah. So you can see that this is freely moving here. That is important for us to know. And this is the assembly in which you have to put the whole assembly together, and just again make sure that the lens is going in front. This is the central hole which you can see, and it should be very well aligned. Now when we have this loading done, I'm going to go straight to the patient's eye now. You can see that already I have done the side ports and the main port. I use what is called as the angled side port incisions so that I can have an easy access to the haptics and the foot plate to tuck them in. Rahul, please look in सीधा दिखना है बेटा आपको लाइट में. आपको लाइट दिखाई दे रहा है सामने? हाँ, yes. आपको ब्लिंक करने की कोशिश नहीं करनी है. So I'm going to implant the lens now. Yeah. सीधा ही देखे रहो बेटा. So as you can see, this has to be a very controlled and slow release. In this patient, the entry chamber is too deep actually. It is 3.6 millimeters. But even for normal patients, it's important that your loading should always be done parallel to the iris and not like IOL. So I've already implanted the lens. Can I have some viscoelastic, please? So this lens fortunately requires no rotation. But in Biotech, the rotation is not more than 15 degrees, as against the ICL when the rotation can go up to 22.5 millimeters. And that's why it is seen that the vault prediction is very, very accurate in the Biotech Acryl lenses. They're also slightly more stiffer, and that's why the studies have already shown that the what is called as the dynamic vault variations in Biotech are actually lesser as compared to the other lenses.
So, Vardhaman, what was your incision size for this?
This was 2.8 millimeters.
2.8, okay. And
So
I saw that you...
with the star, that is 3.2.
Right.
So these, let's say that the incision size is also smaller. So I have already tucked in the front foot plates. I am going to tuck the lagging ones. And now we have the lens which is absolutely in place. I can already see here that the lens looks good in terms of its vault.
Right.
So have the eye, please. And it is always important that you use the regular HPMC and not use the dispersive viscoelastics, because you don't want the viscoelastic to be trapped between the lens and the anterior capsule. It is important that you evacuate the viscoelastic 100% completely. The value of the central hole is very important, because the central hole achieves two things. Number one, it allows the viscoelastic to come out even behind the lens. And second thing, of course, is that you don't need a peripheral iridectomy in these patients. Fortunately, the design of this central hole is such that the halos and glare are very, very minimal. I've been lucky to have been implanting phakic lenses from 2009. And I think on an average, we do close to 80 to 100 phakic lens implants every month. Biotech acrylic lenses are something that I'm implanting for almost 8 to 9 years. From the very first time that they were introduced, we were one of the first centers also to evaluate them. And I'm extremely happy with the prediction of the vault, with the safety of the lens overall, and with the quality of vision that the patients are getting. So yeah, overall, a fantastic lens, especially for someone who would like to start the phakic lens implant journey, because they are easy to maneuver, easy to load. So they are very surgeon-friendly lenses is what I would like to.
You don't have to relearn the injecting process, also loading process, because
Yes.
it loads very much like the way your intraocular lenses do load.
Absolutely,
Okay,
ma'am.
thank you so much, Vardhaman.
Thank
Can we
you
move
so
to
much,
the
ma'am.
next case, please?
Excellent surgery, Vardhaman.
Very
Thank
nice
you
and
so
very
much, Dr.
different,
Chandra.
because we've been seeing phaco and then
Yes, so
suddenly
it's-
the phakic lens is a very
Thank
nice
you.
change.
Thank